I'm going to share with you is something that happened to me personally. And the reason I share it with every single class is I hope that you will take even one small portion of it with you, tuck it in your heart, and never let go of it. Because it can make all the difference in the services that you provide to people. A little bit about my family. I told you earlier, my name is Diane Yates. I'm a licensed independent social worker supervisor. I'm also a certified senior advisor. I am originally from Rhode Island. Did anybody guess that I had an accent? You did? You heard my accent? What did you hear? What did I say? Oh, really? Well, I used to talk kind of weird when I moved out here at first. But when people started asking me, like, where are you from anyway? I was like, what are you talking about? I sound like the rest of you. I thought I sounded like the rest of you anyway. But apparently I didn't. And so I started listening to how you all talk in the Midwest. And I was like, well, how do you say number and doctor and lawyer, letter, Takakana, and line, whatever, you know? And so anyway, eventually I started listening how you speak, and you put your ERs in the right place, INGs in the right place, A's in the right place, and every once in a while my accent slips out. So I'm letting you know that, because if I say something, point it out to me, because I'll tell you, this lady right here, she has pointed out to me many times over the years, like, oh, you just said that, that's Rhode Islandese. So I try to correct it. I try not to sound like I'm from another place. Unlike Nathan, who's never going to change the Southern boy in him. Southern slang, that's it, permanent. But anyway, it's important to the story that you know I'm from Rhode Island because my entire family is there, except for the daughter that I told you about. I have a mom and dad there. They've been married 52 years now, this past May. And Dad's 6'4", Mom's 5'2". That has nothing to do with the story, but it's a cute visual because they are very close, and that part is important to the story. My mom and dad, they hold hands when they're walking down the street. They hold hands in public. If there was no seatbelt law around, this would be Mom on Dad in the car, because that's how they used to sit before the seatbelt law came on. They kiss in public. They hold hands when they go to sleep. I mean, the whole 9 yards. They're very close. I have an older brother. He's married, and he and his wife have children, and so I've got nieces and nephews from that relationship. I have a younger sister, and my sister is married and also has sons and a daughter from that relationship, so nephews and a niece from that relationship. I have another younger sister. She's partnered. She and her first partner had 3 children together, and now the new guy she's with, they have no children together, but still, I consider him my brother-in-law, and then, you know, so niece and nephews from that relationship. I also have married children in Rhode Island. I have a 34-year-old son, and he, what? Questions? Okay. 34-year-old son, and he and his wife have 3 children, so 3 grandchildren from him. I have a 33-year-old daughter who just had a baby. I have not even met my newest granddaughter yet. So I'll be going to Rhode Island soon to see her. But Olivia was born in February. And then I have another younger son who's almost 33, and he and his wife have 2 children. So I have 3 married children there, 6 grandchildren. And there's, again, that's important to the story that I'm going to share with you. I think that's probably all that's critical as far as my family goes. But I was a pretty stressed out kid way back when. And when I was 8 years old, I developed a condition called psoriasis. Anybody know what that is? Okay. So it's a dermatological condition, skin disorder, and stress actually exacerbates that condition. So somebody who has psoriasis, if they get stressed out, the psoriasis can spread. And it can actually get pretty bad. I was covered at one point, probably 85-90% of my body was covered, and I was hospitalized for it. So it was pretty bad, and that's just an indicator of a level of stress. When I was 16, I developed yet another stress-related condition, and that one is called ulcerative colitis. Anybody ever hear of that? Sort of. Ulcerative colitis is bleeding ulcers in the colon, and it is treated with sulfasalazine, so a sulfur drug, and it's treated with prednisone steroids. So the weight gain, on and off over the years. But when you are sick with ulcerative colitis, it literally feels like your stomach is being shredded with a meat grinder, literally. Bloody diarrhea, lose weight, low-grade fever, you just feel yucky quite a bit of the time. And it's really, really hard to have that illness. And then I was married, had my kids, and then something happened in my marriage that I wasn't expecting. And long story short, I developed yet another stress-related condition. This one is called pyoderma gangrenosum. Probably something you've never heard of before because it's a very, very rare condition. When they did the DNA testing on me and my family, they found that it had everything to do with the defective 6th chromosome. So that's why I ended up with that condition. But most people who get pyoderma gangrenosum either have the psoriasis or the ulcerative colitis. You usually don't get all three. But I was one of those recipients who got all three. And it's a rare enough condition that when doctors hear about it, they want to study the person. They want to know more because it's that rare. So what pyoderma gangrenosum is, it's ulcers that erupt on the outside of the flesh. And I told you I already had the ulcers on the inside, so now they're getting bad enough that they're erupting on the outside. And just to give you an idea, this is the scar of one ulcer. It was 6 inches long, it was 5 inches across, and it was all the way down to the bone. The pink area was the actual ulcer itself. See all this extra area? No. Nurses did not know how to treat it. They put dry dressing on an open wound. What do you think was happening every time they changed my dressing? I was watching my own flesh being ripped from my body, and let me tell you, I was screaming every time they changed my dressing. They didn't realize that there were Telfa pads that you could use, and eventually when they did, that's what stopped all of this. But with this disease, debriding the wound, does anybody know what debriding means? It's kind of sloughing off the skin. Debriding the wound on purpose actually spreads it, okay? And the condition, once you have it, any trauma to the skin can cause this to come up. Now, to give you an idea about the pain associated with this condition, there is no English human word I can find to describe the level of pain that goes with this. There's just none. Years ago, I had a situation where I was hemorrhaging. I had just had a period, I was anemic, and now I'm hemorrhaging. So I was sent to the emergency room and they said, we got to see how bad this is. So they gave me one of those big long maternity pads, put that on, and within a minute and a half, I had soaked through the pad, through my clothes, through the sheets. So they knew it was pretty bad. I have a scar here from where they hooked me up for a blood transfusion because they were pretty sure I was going to need one. And anyway, they had me lie flat on my back because I definitely couldn't be walking around hemorrhaging like that. So they called the surgeon. Well, apparently he didn't think there was too much of an urgency. He said, just have her lie down, see what happens. Well, this was an overnight thing in the ER. So hours later, I said to them, I need to use the restroom. And they said, well, you can't walk if you use bedpans. No, me and bedpans do not get along well. No, I really need to use the restroom. No, you cannot get up. There's slide a bedpan under you. Okay, whatever. So as soon as I sat up, remember what happens to blood when you're hemorrhaging if you lie flat? It's pooling. It's not stopping. If you've got internal hemorrhaging going on, it's still pooling, okay? As soon as I sat up, just the action of sitting up, this huge clot fell out. Literally this big. Literally. And the nurses forgot that I was right next to the nurses station because I said, something just fell out of me. And they said, okay, let's look. And when they saw the size of it, they were like, oh, we need to call the doctor. And then they walked out with a bedpan going, oh my God, you see the size of this clot? I was right next to the nurses station. I heard them. So they were on the phone with my doctor. All of a sudden, the doctor finds it important to get there now, so he's there, and they decide they have to do surgery. But it's in Rhode Island. It's a small hospital. Surgical rooms are already taken, but they need to do this now. So they take me into a side room where they counsel people who've just lost a loved one, and this is where they're going to do my surgery. But they cannot put me under any anesthesia because my blood pressure was 90 over 50 because of how much I was hemorrhaging. So they said, well, we can numb the outside, but you're going to feel everything. And they went in and they cut and they sutured my cervix with no anesthesia. So the females can probably get a little bit of a visual on what it would be like to have your insides cut and sewn with no anesthesia. I tell you that story because to tell you about the leg pain, I would take that surgery 1,000 times over because the leg pain is thousands of times worse than that with what goes on with the level of pain with this. This condition, like I said, it starts with just a little bump. It doesn't matter. Any contact to the skin, any trauma to the skin, it starts up. It starts up like a little mosquito bite. It's red. It turns black. It starts to grow. It erupts. And the pain is excruciating. As high as it is on the outside, it's as deep as it is under the flesh. So as these things grow, they grow like little bubbles and stuff. So if it's like a golf ball, half a golf ball on the outside, that's what you've got underneath. So anyway, the first one happened at the end of my very first marriage, and when I was lying in the hospital, the doctor said to me, you must be under some very serious stress. You've already got stress-related illnesses, and for this to come up where ulcers are erupting on the outside of your body, you must be under some very, very serious stress. And I was the type of person trying to be a good Christian wife, regardless of what my husband did. I wanted to forget, move on, you know. And I guess I was doing that up here, but it wasn't here, it wasn't here, and it was affecting me physically. And when they told me if I don't do something about this, that I'm going to lose my leg, that's what made me decide this marriage isn't worth it anymore. It was too hard. And I'm not advocating for divorce. I'm just saying this is the story. So, anyway, I did go through a divorce, and my kids, my older kids, did not want to move, but I was getting out of Rhode Island. It's way too small there. You know everybody. I don't care what town you go to, you know somebody that knows somebody. And I needed to get a fresh start without all of that that's been a part of my life that's caused all this level of stress to me. I needed to get away. So I met someone else. I moved out here to Ohio, and my kids wanted to stay there. They were finishing up high school, had jobs, whatever, and I understood that. That was okay. I understood. So I came out here, and my first mission was to get pregnant. I wanted another baby. I knew I was getting close to being 35, and I said, I got to do this. Because, you know, at 35, they really start testing for Down syndrome and all of those things. So I didn't want the baby to be at jeopardy at all, so I said, I really, really want to get pregnant. So that was my mission. I was on a mission to get pregnant. And I don't need to describe the mission, just know that it happened. And I was successful within 2 months. So, yeah, within 2 months I was pregnant, and actually, because I told you the weight loss, weight gain with this condition, you know, I've been on steroids on and off and everything, I was at a point where, you know what, I'm not getting pregnant, I'm probably never going to have another child, I already have 3, I should be grateful for the 3 that I had, etc., etc. And I went to a doctor and I said, let me do a weight loss program. So when I was going to do the weight loss program, I said, you know, I've been trying to get pregnant. I haven't even missed a period yet or anything, but, you know, let's just check before I do this weight loss program, because it was those diet drinks, and I didn't want to starve a baby or anything, so. But I didn't think I was, and I hadn't missed a period or anything. So I went and took the blood test. He goes, I'll do a blood and a urine, and both of them came out positive. I was so excited that, because I wasn't expecting it, I was so excited, but yet I felt like I'm doing all the wrong things. I felt like, how could God bless, what I'm doing? This is not right, and all of that, because I wasn't married at the time, and all the things I disagreed with I was doing. And then I thought, today I know why God blesses that stuff, because that's what grace is. It's unmerited, undeserved favor. But anyway, so I'm pregnant. I've got this baby, and I can't even enjoy my pregnancy because I don't think it's real. It's too good to be true, So anyway, when I was 4 months pregnant, the guy I was with, I just call my husband, it's easier for the story. My husband, he is very much a mall shopper. Likes exquisite things, likes expensive things, and me, I'm a blue light special, okay? I am quite okay shopping at Walmart. I'm okay with going to get secondhand clothes. I'm okay with that. That's me. I mean, if you look at my shoes right now, I got holes in them. I don't care. I'm not that kind of person, okay? I don't have to have the best of everything. And I said to him, look, here's the deal. This is who I am, and that's who you are. I'm not going to try to change you, but please also don't try to change me. I don't want expensive gifts. That's not what I'm used to. I've never lived like that. It's not what I'm used to. But yet, I'll save my money and I'll get you the things that you like, but please just don't try to change me. But when he asked me to go to the mall, and you know what, folks, I won a $300 gift certificate to the mall one year, and I gave it away because I cannot stand going to the mall. I don't know. I actually gave it to somebody who works here. I was like, you want this? And they went out and got all work clothes and everything, but that's how much I despise going to the mall. I wouldn't even go there, so I gave away a $300 gift certificate that I won. But anyway, he wanted to go to the mall, and I said I would not try to change him. So trying to be honoring and respectful to him, now I gotta look the part, and my God, I'm sorry, but when you buy clothes like I buy, you look like you've shopped at Walmart and stuff like that, So I'm thinking, okay, I've got to find something that looks halfway decent. So I put on an outfit, and remember, I'm 4 months pregnant, so I've got a maternity outfit on. And, girls, don't you have that, favorite pair of shoes that are just too cute, I had these leather boots with a little bit of a wooden heel on them. And I hardly ever wore them because me and heels don't get along either, like bedpans and heels, we just don't. And so, any of you hear about self-fulfilling prophecy? When you tell yourself, I'm going to fall, going to fall, going to fall, you're going to fall and fall, right? So anyway, I put on these boots thinking, well, at least this looks more like a mall shopper, and so I don't want to embarrass him. So I go out, and we're walking around the mall, and I'm walking around in my cute boots and everything, and all of a sudden, I slip. Because I was real concerned about slipping anyway. But I slipped, and I fell on one knee. And what did I tell you about trauma to the skin? Just because I was pregnant didn't mean the condition wasn't going to be there. So I slipped and I fell on my left knee, and within a day or two, here comes this condition. Complication now, I'm pregnant. I wasn't pregnant the first time it happened. The big scar I showed you, I wasn't pregnant that time. And they were telling me, you've got to do something about this because you could lose your leg. So now I fall on my knee, and here comes the little red bump, looks like a mosquito bite, and then it starts to turn black, and then it starts to grow. When I was in Rhode Island, they had asked me if they could take pictures of my wounds and study it. Can they put it in textbooks? I don't care. If it's going to help other people, that's fine. So I let them do that. Well, this time, when I was out here, they asked me the same question. Can we take pictures? Can we put it in textbooks? Can we have student doctors? As soon as they asked me that, I knew this must be pretty special, so I took my own pictures, too. So I brought some pictures to share with you. But here I am. I've got this wound developing, and I'm 4 months pregnant. That husband wasn't exactly merciful to me, and for whatever reason, I think he felt like I was a little bit exaggerating. So I went to go get out of bed one day, and I couldn't get out of bed. I could move one leg, I couldn't move the other one. My leg had gotten stiff. And, you know, you have to urinate quite a bit when you're pregnant, so I'm thinking, okay, I gotta get to the bathroom. And I figure out how to get out of bed, and I'm basically hobbling to get to the bathroom. Well, by the time I get to the bathroom, I'm almost on the floor because I'm in so much pain. And I'm thinking, how am I going to get up on the toilet? How am I going to do this? How am I going to do this? So I figure all that out. I figure out how to get off the toilet, how to wash my hands, and I figure out how to get to the out of the bathroom. And by this point, I am in so much pain, and my leg is so stiff, I can't even move anymore. And I'm literally sitting on the floor in the hallway, and I'm just crying. And I'll tell you what, having this kind of pain, I don't cry very easily. It's more emotional stuff that'll get me crying than it is physical stuff. But I'm sitting on the floor and I'm crying, and my not-so-sensitive husband says, "You want me to call 911? I'm like, yes, please. I felt like I really need some help here, and normally I wouldn't even ask for that, but yes, I need some help. So the rescue shows up, they take my pulse ox, and my pulse ox was so low, they gave me oxygen right there in the apartment. Because obviously, if my oxygen level is low because of the intensity of pain, imagine what the baby's getting for oxygen. So they put me on a stretcher, they transport me to a local hospital, and now I'm seeing people, these doctors in the emergency room, who have never heard of this condition. They've never seen it, never heard of it. And they said, we don't know how to treat this. We're going to call around and see if somebody else can do this. They called all different doctors. And the different doctors are saying, are you crazy? You're right there, and you don't want to deal with this case? You think we're going to take it sight unseen? No thanks. So the doctors came in and they talked to me, and they said, okay, you've got two options. The first option is, we treat your leg, and it will cause a spontaneous abortion. Because the medication is that powerful, the baby will not survive. The second thing is we do nothing, and you will lose your leg. Those are your choices. And I started to cry. I looked up at my husband, I said, how can they even ask me this? And I looked at the doctors and I said, you know, I had learned how to walk with a prosthetic leg, but you saved my baby. And when I did, they refused treatment. Because they felt like it's going to be a lawsuit either way. I'm either losing the pregnancy, and I wanted the pregnancy, or I'm going to lose my leg. So they said, you can't stay here. You can stay here overnight, but we're going to go ahead and send you somewhere else because you can't stay here. So they allowed me to stay overnight, and then I was put in a rescue the next morning and sent off to Ann Arbor, Michigan, U of M. U of M treats about 6 cases a year with this condition from around the country, so they've seen it a few times. Except the complication is that I'm pregnant, so a lot of people don't want to take that risk, but they know how to treat it. It's Whirlpool treatment and steroids. That's how you treat this condition. The Whirlpool is not meant to debride the wound. The Whirlpool is meant to keep it clean. And then the steroids is hopefully to, reduce the swelling and the inflammation that goes along with this condition. So, but that's the treatment with steroids and Whirlpool. So I was put in a rescue and I was taken up to Ann Arbor, and the pictures I'm going to share with you right now is what was going on. This is from Ann Arbor when I was in the hospital there. The first picture is kind of dark, but it's the wound, like I told you about. The second picture, you see the first scar that I showed you on my leg, and then you see the wound on the knee, and it's got a little tiny bit of drainage. The third picture is I'm not flipping anybody off. My middle finger is over my leg because my husband at the time was in the police department. And he needed a button sewn on the outer coat because it's real thick material, and I was trying to sew this on, and I nicked my finger with the needle, and like I said, any trauma to the skin, well, I had the condition on my finger as well at the same time. So it's a picture of the wound on my finger and the wound on my knee at the same time. And then the fourth picture is the wound had burst open and everything else, and this is a while after, but it was clean. It's a clean, open ulcer. Okay? So these are not bloody. I'm just going to ask, I will pass them around, but I'm going to ask that you be respectful. If you choose to look at them to yourself. Don't hold them out here where other people have to see them if they don't want to. Pass them to the next person, face down, because if they don't want to look at them, you know, I just want to be respectful of that. And then the last person can just bring this to me, okay? You want to start? So this is when I was 4 months pregnant, and this is the wound that I'm talking about when I slipped and fell. So anyway, obviously I went through the treatments there and everything, steroids and all of that, came home, and the condition was not merciful at all, because during the pregnancy, it came up about another 65 to 68 times. And my husband and I, it came on with no notice. Sometimes it just came out. Like my flesh would be like this, perfectly clean, nothing wrong with it, and all of a sudden my flesh would just burst open. So one day we were driving, we were on Monroe Street driving either to or from Kroger's, I don't even remember. But we were driving, we were going grocery shopping, and all of a sudden I go, ah! Like this. And, you know, girls, we all have different peripheral vision than men do. We see things a lot closer. That's why when they're driving, we're always, because we see things a lot closer than they do, okay? He thought that he was almost going to get in an accident. He's slamming on the brakes, and he's all upset with me. But what had happened was my flesh had just burst open with no warning. So the next set of pictures I'm going to show, it's only 2 pictures, but the first picture is bloody. And what it is you can see all these mini ulcers. You can see the holes in my leg where these things had just burst open, and there's blood dripping down my leg. I couldn't go anywhere or do anything after that because I never knew what it was happening. The second picture is that same area, but it's kind of clean after it heals up a little bit. So that's these pictures. But I am pregnant in these pictures, and you can start to see, again, the weight gain from the steroids there. So then, moving forward a little bit, I'm still pregnant. And that was the last of the situation that happened while I was pregnant. Then my daughter is born, and she was born 5 weeks early. The little teenage girl that I told you about now. She was born 5 weeks early. She was 6 pounds 2 ounces 5 weeks early. So you can imagine what a little horse she would have been had she incubated the rest of the time. But she was 6'2", and she was completely healthy because the steroids actually help develop her lungs and everything else. Now, they're not going to give pregnant women steroids for the heck of it, but it actually benefited me, and especially because she was born early. And there's a whole miracle story around that, but not for this class. So that's a whole other story about that little miracle. But anyway, she was born, and she's healthy, and NICU was in the room and everything. And I told you I was on a mission to have this baby, so I was on a mission to take care of this baby too. And I said, she's not going in that little bed. She's with me. And right in the recovery room, they put her in my bed, and she never left my bed. When I was taken up to my room, she was there. And it was super, super, super important to me that I nursed my baby. This was, I knew, going to be my last child. So back in the day, you know, when I had all my 3 kids back to back, got one swing going over here, another swing going over here, using the foot over here and keeping everybody happy, you know, because they were all babies at the same time. I said, if this baby needs to be rocked, it's going to be in his arms in a rocking chair. I will not buy a swing. And when she needs to walk, I'm not using a walker. I'll get the little toys that she can push, and I'll be right there. This baby's going to be with me all the time. And remember, I said, my whole family's in Rhode Island. Who do I have here that I would trust? There's nobody here. There's nobody here. So I've got my little baby now, and I was at Lourdes at the time that she was born, Lourdes University, what was college at the time. And I recovered very, very well from surgery. She was a C-section birth. Remember what I said about trauma to the skin. So what do you think happened when I got cut? I had the wounds come up above and below the incision. But she was born on a Wednesday. I was back in school on Monday, baby in tow. After a C-section, major abdominal surgery. The day I got home with her was Saturday. She was born Wednesday, I was home Saturday. I cooked, did laundry, played cards. That's how I recovered from surgery. Again, after going through something like this, surgery is nice because you at least have pain medication, it's expected. You're not just being ripped open. I mean, you're getting sewn, cut, all the right way, the right thing. So anyway, I recovered well from surgery. So we had her, and all is going well, and I don't have too many problems. And then all of a sudden, when she's 2 months old, the condition comes up again. This time, it comes up on the side of my knee. And the next set of pictures, I'm going to show you, there's 4 pictures. The first one, it's an open ulcer, but it's not bloody, okay? It's an open ulcer, and if you put the first 2 pictures side by side, you see one's like this, and the next day, like within a day, it's literally grown that much. The third picture is where the whole back of my knee is missing. The 4th picture I just found recently, not too many classes have seen it. What had happened was I told you that Whirlpool treatment is part of, treating this condition. As part of my outpatient treatment, I went and got the Whirlpool done, but they sterilized tubs, and they sterilized them with chlorine. They forgot to put me in a tub that had already been sterilized, and they put me in the one that was sterilizing. So the open wound, we were dropped into chlorine with an open ulcer. So the red rawness of that ulcer is because of the chlorine that day. Oh my gosh, big time. I did scream. But, when it comes to the Whirlpool treatment, like, they have the little chair, they sit you on it, and they wiggle you around, and then they drop you in. So and remember the level of pain when you've got this going on. I couldn't just yank my leg out. I had nowhere to yank it out to. So I had to scream for help, and they came running in, and they got me out of there and stuff, but damage is already done. The chlorine's already in there. And you'll see the blue lines on my leg that were drawn because I had cellulitis setting in from all the disease process that was going on. So that's what's going on in those two. I did not. I'm the only one in my family with any of these conditions. Nobody else has psoriasis, nobody else has ulcerative colitis, nobody else has this condition. I'm the only one in my family. My cellular family, my extended family, nobody else has it.
You're not that guy.
So anyway, I have her, I have all this stuff going on, and they're telling me you really need to do something about this, because look where it started. It started down at the bottom of the leg, came up on the knee, came up around the knee, now it came up and took out the back of the knee. It's traveling up. You're going to end up losing your leg. And remember, it came up on my finger, it came up on my abdomen, and I'm thinking, yeah, I know, I got to do something, because if I don't do something, they're going to be cutting off different body parts at some point. They told me the reason that this was so bad is because it's related to the ulcerative colitis. And they say that every year after 10 years that you have ulcerative colitis, every year represents 10% chance of colon cancer. I was 18 years into the disease. So I'm at an 80% chance of colon cancer. And they said, usually the surgery that helps or cures this condition is the removal of the entire large intestine. But I'm stubborn, And it was more important to me that I nurse my baby. So I said, I'll do the surgery, but it's going to be after I finish nursing. So fortunately, that last set of pictures was the last time that it had come up. And then I nursed her right up until about 11 and a half months old. And then I decided it's time for surgery. So I scheduled the surgery for January 19th, 1998. My family in Rhode Island are saying, do you want us to come out there for her, for your surgery and whatever? No, I got this. I'm good with surgery, And it's January. I do not want my family traveling. I don't want them on a plane, where ice can get on the wings, and New England gets really, really bad storms. They had one this past year where they got like 2 feet of snow on the day my granddaughter was born. So her doctor, who lived less than a mile down the street, couldn't even deliver my granddaughter because he couldn't even get out of his driveway. So I know how bad the winters are, and I do not want my family traveling in this. For what? I'm going to be in the hospital an extra day, longer than a C-section. I'll be fine. Stay home, stay safe. I'll keep you informed. I even told my husband the same thing. Keep the baby home. I don't want her out. I don't want her cold. I don't want her getting sick. She's been extremely healthy this whole time. Keep her home. So I know no one's coming to visit because remember, I know no one out here. I know no one. But I'm okay with that because what do you do after surgery anyway? You just sleep and whatever, watch TV, talk on the phone. I mean, that's what you do until you go home. So I told everybody to stay home. So we scheduled the surgery for January 19th, 1998. It was a Monday. And I was told by my surgeon that the surgery was going to take approximately an hour to an hour and a half. And they were removing the entire large intestine. They were going to do what's called a J-pouch surgery, so that they could reconnect everything, so that the small intestine would then kind of act as the large intestine, and that was the goal of the surgery. They told me it was going to take 3 liters of fluid to keep me hydrated during surgery. Now, you all know what 3 liters of fluid looks like, right? Think about those are 2-liter bottles, so that and a half. So they said 3 liters of fluid to keep you hydrated during surgery. Okay, that's fine. I'm not one of those people who get scared before surgery. Some people, it really freaks them out. They hate surgery. They're, stressed out the day before or weeks before or whatever. I am not like that. Trust me, if you've had your flesh just ripping open, and surgery is like a welcome thing to happen because at least it's planned and you're going to have medication and you've got doctors in control. It's not like something's just happening to you. So anyway, we have the surgery. And I come out of surgery, and my surgeon's there in the recovery room. Now, surgeons don't hang out after surgery. They let the recovery room nurses wake you up. But my surgeon is there, and he's calling my name so he can wake me up. Finally, I respond, and he lets me know that surgery didn't go quite the way they had planned. That they had run into some complications, and actually, what was supposed to be an hour to an hour and a half surgery ended up being like 3 or 4 hours. And they had to flip me on my side during surgery because the places where they were trying to reconnect things, they were having a hard time doing it, and they had to do this. They said that the amount of fluid it took to keep me hydrated for that length of time ended up being 12 liters of fluid. So they proceeded to let me know that I was excessively swollen. Okay. I'm still okay with this because I realize this is a rare surgery, rare condition. I get that. So I was okay with that. So they took me up to my room, and my male nurse is there. He introduces himself, checks my band, confirms my name, asks me about my pain. Well, heck, I was just in surgery for 4 hours. What do you think they're pumping into you for 4 hours while you're in surgery? So I've got all this good pain medication there, and I'm like, no, I'm feeling just fine. I'm good. My pain's okay. I said, but it just feels like something is leaking. So he looks under the sheets. He's like, nope, you're good. I said, all right. He says, well, do you need anything before I go? And I said, no, I think I'm just going to sleep for a while. So, okay. So he leaves the room, and I go to sleep. I mean, what else are you going to do after surgery, right? So I go to sleep, and I wake up a few hours later. And remember, nurses are on 12-hour shifts in the hospital, so this is my 7A to 7P nurse. I wake up a few hours later, and now I'm starting to feel the pain, and I'm thinking, don't be a hero, just ask for some pain medication, who cares? Because I'm one like, if I get a headache, I won't take a Tylenol, I'll sleep it off first, and So I'm like, don't be a hero, just ask for some medication. So I rang for my nurse. No nurse. So I waited a while, because I know they're busy. I mean, what's the ratio that you can have when you're in a nursing home or... Right? It's like 1 to 15. I don't know what. Does anybody know what the hospital ratio is? 1 to 5. Okay. So he's got other patients that he's responsible for, and I get that. And I'm not a bad patient to have. I'm actually pretty helpful when I have nothing else to do. I ask them to give me charts to put together or whatever. So I waited a while, and I rang for the nurse again. No response. I wait a little bit longer, and I ring for my nurse again. Finally, he comes to the room. He stands in the doorway. Can I help you? Oh. Like I had irritated him. And I went to say to him that I'm starting to feel some pain. Could I please get some pain medication? And I had no voice. And I don't mean I had laryngitis. I mean I had no ability to speak. My vocal cords were not working. And I'm trying to talk, and nothing's coming out. And I'm thinking, my youngest son was a C-section, my daughter was a C-section, that's major abdominal surgery. This is my third one. This has never happened before. And I'm getting scared because, why is this happening? So I'm trying to talk to this guy, and he's getting frustrated with me. Because guess what? He knows I can talk. We just talked a little while ago. So now he thinks I'm purposely avoiding him. I'll just get pain management. Okay, well, at least he's going to get help, right? So about 20 minutes later, he and pain management guy come back. And now my nurse is acting like he's been my best friend all along. And he says to pain management guy, my patient appears to be in pain, but she won't tell me how much pain she's in. I'm a relatively intelligent person. Even though I didn't have my bachelor's or master's at the time, I'm relatively intelligent, but this one I couldn't figure out. And I could not figure out how to communicate with these people because I'm excessively swollen, can't even fit a pen between my fingers to write them a note. I can't speak. I know I can't call my family because I have no voice, even if I could reach the phone and dial the phone. I have no idea how to communicate with these people. So now, my nurse says to this pain management guy, my patient appears to be in pain, but she won't tell me how much. Now he's getting me upset. Because not only am I in pain and I'm scared because I can't speak, now you're talking about the patient in front of the patient. So pain management guy thinks he'll get it out of me. So he says on a scale of 1 to 10, how much pain are you in? And I'm laying there trying to think, like, come on, you're smart enough. How are you going to communicate with these people? So I thought, I don't know what else to do. So I made these big puppy dog eyes, like I was very, very sad. And I started to cry. And I can't usually make myself cry, but then, because I was scared and in pain, I was, like, able to make myself cry. And pain management guy looks at my nurse and he says, is she always like this? And my nurse said, you know how they are. Talking about the patient in front of the patient. And if you're female, apparently to these two gentlemen, that's how you deal with things. You just cry anyway. Now you've really ticked me off because you know what? I'm not a crier. You have no idea what I've been through all this time, and you're sitting there talking about me. Really? So pain management guy says, well, I'll get a bolus of medication, that should help, etc., etc. So, okay, at least he's going to help. So he leaves, they both leave, brings back a bolus of medication, hooks me up, I don't know if it was morphine or whatever it is, knocks me out. So I fall asleep. And that works for a while. And then, you know, it's daylight savings until this January. Okay, daylight savings. So I wake up 4:30, whatever it was, and it's kind of dark in my room, and I've got no roommate. And this is back in the day when you had to pull the switch behind you to put a light on. And the phone was over here with the curly cords, no more cell phones or anything, no cell phones at the time, you got the regular phone. And if you wanted your nurse, you had to have the call button like on the beds over there, it wasn't like right on the bed. And anything you wanted to do, your TV even, you had to pull it toward you, turn the channel, there was no remote control or anything. So I'm looking all around like I can't even bring light into my room because after my surgery, I had a catheter, I had an IV, which is normal in surgery, but I also had an NG tube and I had JP brains. So I've got tubes and I can't stretch. I just had a 10-inch incision. So I'm looking around and I'm thinking, God, I hate to call this guy, but I don't have a choice. He's all I got. So I ring for the nurse. No nurse. And I'm watching in the hallway, there's lights in the hallway so I can see people walking the hallways. And I'm thinking, well, at least somebody's going to poke their head in when they see my call light is on. Somebody will poke their head in. Nobody ever did. I wasn't their patient. Family members are walking up and down the halls, laughing, joking, visiting their loved ones. I wait a little while because I already know this guy's mad at me for whatever reason. And I don't want to tick him off. I got to count on him. So I wait a while, I ring again. No nurse. I wait a period of time again, ring for the nurse again. No nurse ever comes back to the room. Leaves me there like this. I start feeling sorry for myself. I start to cry, and I'm like, they're just going to leave you here to die in the dark, and and I'm feeling sorry for myself. And I'm like, what's the point? What's the point? Just go back to sleep because you can't do anything. So why sit here and feel sorry for yourself? It's not helping to be laying here crying and feeling sorry for yourself. So I just went back to sleep. 7 o'clock rolls around, shift change rolls around. And this chipper little nurse comes in my room and she's like, hi honey, how are you? And I know Miss Dawn told you don't call people honey, dearie, sweetie, right? You find out what they want to be called and you call them by their name. But in this particular case, I needed to hear that. I needed to hear, honey, how are you? I needed to hear that. Because to me, she was saying that she cared. And I just start crying because I'm scared, I'm in pain, I can't talk, I don't know what's going on with me, but oh my gosh, somebody is here who cares. And when she sees us here, she says, honey, are you in pain? Well, there's a question I can answer, because I can go like this. Why didn't anybody think to ask me that before? A yes or no question. When I couldn't answer their questions, why didn't they think about asking a yes or no? Okay, so I shake my head yes. She looks at the bolus of medication. She says, it's been a while since pain management has been here, so I'll go ahead and call them again and have them come in and take care of this for you. Okay. At least I'm getting some help, and I'm so appreciative because this nurse goes on to say, I'm going to give you a back rub. That'll make you feel better. And I'm thinking, oh my gosh, I am so appreciative. So now my tears are not just saying I'm scared and I'm in pain, but I'm also very appreciative. Like, you have no idea how happy I am to see you. But I can't tell her what I'm thinking. I don't have the ability. She looked across the way from my bed. She sees the chair with the sheets, the gowns, the blankets, everything sitting there. She says, honey, didn't anybody wash you up after surgery today? I shook my head no. I bet she was seething with her fear. I bet she was very angry with him because he didn't do his job. Now she's going to do it on second shift. But guess what? She never let me see that. Even if she was angry, I never knew it. She didn't show that to the patient. She said, honey, I'm going to get you washed up. We're going to change your sheets, give you a back rub. She's telling me a plan how she's going to help me. And I'm thinking, God, at least somebody cares. So she gets everything. She brings it bedside. And she's got the basin there and everything. She's ready to go. She pulls down the sheet and says, oh my God. And throws the sheets back over me, runs out of my room. She went and got her charge nurse. Charge nurse comes back, and there they are, they're talking. I'm not advocating for what this nurse did, I'm just telling you the way the story happened. Because whenever something happens in the facility you work in, you should try to resolve it internally. Right? You don't go over people's heads or anything like that. But this particular nurse, it was her last day at that hospital. She told me later on she didn't care what happened to her. She did not care if they sent her home. She contacted the hospital administrator because she was so appalled at what she saw. The next thing I know, I've got the hospital administrator in my room, some woman in a suit, I don't know if she's the hospital attorney, his administrative assistant, I don't know who she is. 7 o'clock at night, or whatever time it was by then, 8 o'clock, I don't know. But at night, the hospital administrator is there, this other female in a suit is there, the charge nurse and the little nurse, and they're all apologizing to me for this care that I've received. And I'm thinking, I don't care about apologies, just help me. Just help me. So after everybody leaves, my little nurse tells me what's going on. She said, honey, had your day nurse taken your temperature, pulse, respiration, blood pressure, they would have realized that something was seriously wrong. My temperature was 103.8. Because my surgical site had ruptured. Early in the day when I said I felt something was leaking, it was. My surgical site had ruptured, and I was left like that all those hours. So, all the stool was free-flowing through my body. The JP drains were full of it. The NG tube had it in the NG tube. It was backed up in the catheter, in the IV, and on the outside of my gown, so it was coming out of everywhere. She said the reason I couldn't talk is because I was actively dying. I wasn't about to die or going to die. I was dying. I was actually dying. Because of a nurse. Not listening to a patient. Not doing their job. Taking shortcuts. So, think about this. Think about how swollen I told you I am. They've got to take all these contaminated tubes out and replace them. All of them have to come out and they've got to be replaced. Think about the pain of trying to find a vein when they got to replace just the IV, let alone all the other stuff. My folks, who are in Rhode Island, my mom and dad, remember I told you they're real close. They probably sitting there holding hands, sitting on a couch watching Who Wants to Be a Millionaire or something. Get this phone call. Mr. and Mrs. Paris in Coventry, Rhode Island. This is such and such a hospital in Toledo, Ohio. We don't know if your daughter's going to live. I don't share the name of the hospital because it's not the hospital's fault. It's the fault of one person who didn't care. I would never put the hospital or the facility down because of one person. So I don't share the name of the hospital because it happens at all of them. It does. So my mom and dad get this phone call. So for the first time, my mom has to get a flight and come out here because their daughter is dying. Not Mike's gonna die or what, she's dying. My mom gets a flight. She flies into Cleveland overnight. That's the only flight coming in from Rhode Island. And she has to taxi into Toledo because there's no other way to get here. And guess what? It's in the middle of the night, like 2, 3 o'clock in the morning by the time she gets here. And it's her birthday, January 20th. So she gets to spend her birthday with her dying daughter. So, there we are. I'm lying in the hospital, my mom is there. And this day goes by, can't do anything. Next day goes by, can't do anything. Because they're shooting Tylenol into the NG tube trying to bring down this temperature. They cannot do any surgery while my temperature is so high and my body is so unstable. They've got to pump out my system. So they've got me hooked up to suctioning. They're shooting Tylenol in the NG tube. And I'm a mess. So Tuesday the 20th, Wednesday the 21st, Thursday the 22nd. Finally, Friday the 23rd, they decide you're stable enough to go in and do surgery. Because remember, this thing is still free-flowing inside. Just remember that. So now they've got to reopen the same 10-inch incision they had already made, undo the first surgery, and redo the second surgery. So they go in on Friday the 23rd, and they redo the surgery. And I don't remember how long that one took, but another 3 to 4 liters of fluid to keep me hydrated on top of the 12 that I've already had. They are talking about putting a PICC line in my neck because of how many times they've already, had blown veins for the IV and everything. But now I come out of this surgery with yet a new apparatus. Now I have an ileostomy. I have a colostomy bag. So I've got my NG tube, I've got my JP drains, I've got a colostomy bag, I've got my IV, I've got my catheter. And the next day, on a Saturday, ostomy nurses show up. I thought I'd get a break for the weekend, but no, they work weekends, nurses. Darn nurses. But the ostomy nurses show up and they say, we're here to teach you how to use your new appliance. Like I was getting a new dishwasher. So they came in and they were awesome. They were awesome. They came in and they unclamped it, took the bag off, took the wafer off, and I looked down and I prayed to God for you that you never see what belongs on your inside ever on your outside. Your brain, you like to know that it's there. Your heart, your intestines, you like to know those things are there and functioning properly. You just never want to see it. When I looked down and I saw my own intestines hanging out of my body, I just started to cry. And they were like, it's okay, honey, we got this. And they hosed it down because they have to wash it. And let me tell you, it's painful. It's painful. It's bloody. It's raw. It's painful. And they hose it down. They got to put powder on it to help dry the area. They have to put paste around it to hold the wafer in place. They got to put the wafer on. They got to put the bag on. They got to put the clamp on. Off they go. They come back the next day, Sunday. I'm thinking maybe I have until Monday. Oh no, they were back Sunday. They're going to show me my new appliance again. They take everything off, and I look down, and I just start crying so hard. You ever cry so hard that the water in your eyes are like shields, like you can't even see beyond the water because it's so thick, and sometimes you can even see your eyelashes sticking together because there's so much water in your eyes? I'm crying like this, and they're like, it's okay, we got it. And I went like this. Because the bottom line is, I've got to learn how to deal with this. They're not going to be there when I go home. They're not going to be wherever I'm going. They're not going to be there. I've got to learn. So I'm crying, and I can't see what I'm doing, but I'm hosing it down, and I'm powdering, and pasting, and wafering, and bagging, and clamping, and I do the whole thing, and I get through it. The third day they come back. This time I do it myself in front of them, and I'm still tearful, but not crying like I was the second day. By the fourth day that they came to watch me do it, I got this now. I'm okay. I think the second day it had really set in that this is reality now. I came in thinking I'm going to be in and out of here like this, and look at me. So that's not enough, because I've got abscesses developing because of how much all that stool is free flowing through the body. But I've got this excessive amount of pain, and they can't figure out where it's coming from, and they can tell that the pain is there because the pulse ox is telling them. The level of oxygen that I'm needing is telling them that there's some pain here, and I'm telling them about the pain too. And the medication they're giving me should be treating this pain, but it's not. So they check it out. They got to do an x-ray. Now, x-rays are not typically painful, right? But think about it. I've had 2 incisions cut into, 10-inch incisions. I've got JP drains, I've got an NG tube, I've got a catheter and IV, now I've got an ileostomy, and I've got to raise my hands over my head and let all this apparatus hang on this very sensitive stomach that's been cut into twice. While they tell me to take a deep breath and stand still. And I'm crying and it's so painful, it takes a long time to get the x-ray. They finally get the x-ray and they realize what's been happening is there's an abscess, a very large abscess, on the area where the cervical site had ruptured. They said the only way to get to this site is through the buttocks muscle. They took me in a side room, they brought in a needle this long, literally, because they got to go all the way through the buttocks, and they said, we can numb the outside, you're going to feel it going all the way in. There's nothing we can do about that. And by the way, you need to sign this paper because you could die through the procedure. Right there and then, I thought about my baby. I thought about my children. I thought about my brother and my sisters, their spouses and kids, my parents, my husband. I thought about everybody. And because they were shooting the Tylenol in the NG tube, I was able to start regaining a little bit of speech. Because when the body, what was happening was I was not able to speak because I was in the dying process. That's what she explained to me. Apparently, when you're dying, your energy in your body is going to keep your brain and your heart alive. It's not going to let anything else function that doesn't have to. So that's why I couldn't speak. So as they're bringing down the temperature, the body's starting to feel a little bit stable, I'm able to speak a little bit. I could say a few syllables, but then it would take me hours of sleep just to regain the strength from trying to talk. It took me a very, very long time, but when they handed me this paper and they said, you're going to sign this because you can die from the procedure, I pushed it away. And I said, please, let me die. There didn't seem to be any hope. Think about it. Every time we're turning a corner, something else is going on. I mean, it's bad enough we got the abscess. Now I can die from this procedure. What next? My surgeon was listening on the other side of the observation window. He walked in the room and says, let me see what I can do. Not a pretty picture, but I'm going to tell you anyway. He goes up into the anus with 3 fingers. Feels around until he finds the abscess. Twist, twist, twist until he ruptures it. Takes tubing, like the straw, this is a little thin, but like a regular straw, takes tubing, stitches it in place, brings it out the anus, and attaches it to a bag on the side of my leg so that this abscess can drain into this bag. So now, I've got my NG tube, my JP drains, my ileostomy, I've got a tube coming out of my butt draining into a bag, and I've got a catheter and an IV. Now we go into February. Let's fast forward into February. Remember, I'm thinking this is a 3 or 4 day thing, I'll be in and out, right? We go into February, my baby is getting ready to turn a year old. And I said to them, I want to go home. They said, you are in no way, shape, or form out of the woods. You are still dying. And it took me a long time to say, but I said, what difference does it make if I'm going to die? I want my last days to be with my baby. If I'm going to die anyway, I don't want to be here. I want to be with my baby. I told you how important she was to me right from the beginning. Like, that was my mission. Now I'm going to die without my baby. I'm like, no, I want to go home. Well, if you go home, you're going to have an, the ostomy nurses come out 3 times a day. You have to have an IV 3 times a day. You have to have this, you have to have that. I have no home care, and I have no one to take care of me except my mom who's here for the next couple of weeks. That's it. That's all I got. And my husband, who's working at the police department and can't take time. I mean, obviously, if his wife's dying, he's going to take time, but he can't just take off an indefinite amount of time to take care of me. So they decide, okay, if all these things are in place, they're going to let me go home. Because really, what difference would it make if I die here or die home? So the female doctor comes in to do the discharge. She looks over the incision to give me my instructions and everything. She said, "What is this?" Drainage coming through the incision. She goes and pops open the bottom 8 staples, sticks her finger in my stomach, opens it up, and all this pus comes gushing out of my stomach because there was an abscess directly underneath the incision. So now, with all the other apparatus, now I've got this gaping hole in the bottom of my stomach that's got to heal from the inside out with the rest of the incision there. You got to go home with the JP drain. You got to go home with this and this and that. I went home with almost everything. They took out the NG tube and they took out the IV and they took out the catheter. That's it. I went home with everything else. The moral of the story, the reason I told you the story, obviously I didn't die. I'm a stubborn Portuguese. I told you I was stubborn earlier. It took 3 more surgeries at the Cleveland Clinic to undo all the damage that was done the first time. The reason I tell you the story, I'm begging you to be the 7 p.m. nurse. Please listen to your patients. Please be creative. If they were talking to you a minute ago and now they're not, there's a reason for that. I don't care if they're stubborn or whatever, there's a reason. Please care enough about the people that you take care of. Because everything you do, every decision you make, impacts lives. And I know you know this or you wouldn't be here. How many people are in this class? We've got 32 people in this class. Is that a lot of people? In the scope of things, 32 people? Oh, no. In the scope of things, relatively small group? Okay. How many people can you take care of the first day you hit the Florida nursing home? What's the ratio? You should all know this because it may be on a state test question. I don't know. 15. The ratio is 15 to 1. You can take care of up to 15 people, right? So, in your entire career, you leave here, you graduate, you come back, you state test, or even if you don't, if you just go on to caregiving without state testing, how many people do you think you're going to care for in your career? Give me a realistic number. What do you think? Thousands. Thousands? What do you think? Alright, so then you will all probably agree with me when I'm super conservative here, and I say each of you will only take care of 10 people your entire career. Conservative and fair? Okay, realistic, even if you go into home care, right? How many lives will this group of 32 touch if you only care for 10 people your entire career? How many? 320. It matters what decisions are made up here. Because what you do up here affects these people. But it doesn't stop here, does it? Because we all have people in our lives that love and care whether we live or die. I told you about my family because they cared. They were impacted whether I lived or died. My daughter never breastfed again. I was too weak to hold her for months. It took me a long time to regain my speech. It took like 3 or 4 months for me to regain all of my speaking ability. I couldn't talk to my kids for a long time. They're wondering, about their mom. I couldn't even answer their questions. It took a long time to get back to the way things are now. It took a long time to get there. Because one person made bad decisions up here. One person took shortcuts. One person didn't care. Got burned out. They got burned out. Would you agree that I had at least, when I told you about my mom and dad, brothers and sisters, nieces, nephews, kids, grandkids, now my kids were not married at the time. But would you agree, prior to my kids' spouses and grandchildren, would you agree I had at least 10 people that loved and cared for whether I lived or died? Do you? if something were to happen to you, do you think that these 320 people do too? Heck yeah. So now, when this group of 32 goes out there, now at a very minimum, how many lives are you really touching? And you all agree this is a very minimum number, right? Because you know you're going to do more up here. But you are affecting lives here with whatever you do up here. What you do behind closed doors matters. Because you're impacting a whole lot of lives with whatever you do, good or bad. Let's say 31 of you say, you know what a waste of our time. I wish you never even walked in the door. But one of you says, didn't quite realize. I knew what I'm here for and stuff, and I didn't quite realize the impact. By yourself, you are going to be responsible at a minimum for touching over 100 lives, at a minimum. By yourself. You are impacting people's lives with what you do. Serious impacting. Is it going to be for their good? That's what you have to think about. Questions, comments, concerns, complaints, compliments, anything with a sound at all? Yeah.
Well, I believe that we touched a lot yesterday because Anita.
Your partner.
My girl. Anyway, one of the residents, I believe she got her feelings hurt really bad by one of the aides. It was busy, or whatever. But
I'm on video.
she got really hurt by that. I mean, I could see it instantly. I was sitting at the table with her. I could see her demeanor just flushed, and it, and I just thought it was really sad. Well, this was in the morning. At breakfast. By about 4 o'clock in the afternoon, we got to go to her room to get to send her, and she was crying in her bed. She was so depressed about that, and so we had to take her a shower, right? And the whole time she was telling us she didn't want to live. Nobody liked her, nobody loved her. People were mean, and she was talking about the specific age. But we were just telling her how much she meant to us. And she was so nervous and everything. And after a shower, to make a long story short, after a shower, because we were telling her positive things about, how we cared about her and how special she was. After the shower, by the time she went to bed, she grabbed his hand, kissing off, she was hugging on. I'm bad with names. I forget my names. That's why I say hey to them. Hey, ain't nobody talking about voice.
Which head?
Hey, you.
All right, shh. Please listen to your peer.
But anyway, by the time we were done, she was kissing her hand. She was telling how much, how thankful she was, and with a smile on her face, her whole demeanor had written up. We made an impact.
It matters.
And because of that, I was saying earlier that I would not put my family in there, but it also made me feel like we could be an example. Because you were saying earlier about the class here, and I was sharing this with my children. I said, there's a saying that says there's no such thing as a bad student, it's a bad teacher. And this is I just feel like this whole group right here is so caring because of the way they're being taught, because how we're being taught. And it's really different. So caring is just Dawn, and she's genuine, and she loves humanity, and she's just genuine, and she's the one that has to be teaching us, or we're being blessed by it. But that's what I wanted to share. It does make a difference. And she was saying that yesterday, and it was so hurtful because they feel like they don't have nobody in the world. They're so active in one day, and then the next day they're fully depending on somebody else.
And let me ask a question of you. How many of you are guaranteed to make it home safely tonight? There was a girl who, your age, she took our classes when we were downtown. This was like 2 summers ago. She took our classes, and she finished, and she signed up for her state test, and then they canceled her state test. She didn't make her state test. And she called us a few months later to thank us for this class. She thanked us for this class because you know where she was? She was in a nursing home because the day before she was scheduled for her state test, she was in a very bad motorcycle accident and lost use of her leg permanently. So she is unable to state test or anything, but she still called us and thanked us for what she learned here because she knew how to advocate for herself, where she was, and we don't know that it's not going to be us. We don't know that it's not going to be our loved ones. That's why you've got to come from a place in your heart. This isn't just about the work that you do in collecting a paycheck. If you can't come from a place in your heart, this is not the field for you. You have got to serve as if this is your loved one. Somebody cares about this person. Somebody loves this person. They have meaning to somebody. And that stuff what you're talking about, that is so important because how did it make you feel? You weren't even doing that for a paycheck. How did it make you feel to know you made a difference in somebody's life that day?
I was excited. I was sharing it with my kids. It was a joyful moment.
Those are things you can't take out of here. You know what I mean? You cannot take that away. And, 17 years ago when this happened to me, I told you I was the original owner and the founder of this program because it has meaning to you. Because if I would have died 17 years ago, you wouldn't be here today. Think about it. Because Care For You Too wouldn't exist if I would have died. That's the impact of my life and yours, and you don't even know it. Do you see what I'm saying? That's why I'm telling you over here, your life, just the fact that you're here, the fact that you're doing this, your life has such meaning to so many people. You are going to impact lives of people you will never even meet. When you're doing this stuff up here, down here, you're affecting these lives, and you may never even meet those people until you're on the other side. You may not even meet those people. Other questions? Yes?
Did you see the dance off at hospital?
I did not. I did not sue. First of all, I was too sick. Second of all, I believe the Lord allowed it to happen so that I could share the story with you. If I would have put a price on that, how would that even have meaning?
I meant just like for your additional surgeries.
No, I didn't sue anybody. First of all, like I said, I was too sick to even think about a lawsuit. But second of all, remember, why would I drive up the cost to all of you because of one person? Like, we all pay. When people sue and they have frivolous lawsuits and everything, I didn't die. I'm here. But I believe the Lord allowed it to happen so I could share it. Because like I said, forget 32 people. If one person says, didn't quite see it that way, forever, I'm going to keep that right here and remember the impact that I have. It was worth happening. It was worth going through. Couldn't put a price tag on that. Other questions? Any other questions? Anything? All right, that's the end of the story. So I thank you for listening and your time. I really, let me have your attention just for another 30 seconds, please. I really do appreciate your attentiveness because for me, for whatever reason, it's super distracting when people are writing and stuff, and I appreciate that you did not do that. Because I end up losing track where I'm at in the story and stuff, so thank you for being very respectful, and especially for such a large group, I really appreciate that you were that respectful, so thank you. Thank you. All right, so I'll let Dawn know that you're ready to do whatever now, and good luck to all of you. Thank you. You're welcome.
We still have to go in tomorrow. I'm sorry, I'll be watching. It's not that bad. I got my
And Dawn, get all your stuff graded, so she'll be able to tell you how you did, too.
We got 4 hours.
What was you late? What was you late? I wasn't gonna stop. Okay, I'm the teacher. Oh. I was teaching the class before you came. Wow, I can't see him.
Girl.
I would like to talk about the extra credit. Oh, I need to stop.